Let's go straight to our gist tonight. Who is ready for tonight's gist? Oh boy, I'm just thinking about you, right? I'm just thinking about you. Thank you for the Go Popular, my crush.
Every heartbeat tells us.
You know, we have been in the business of
This is fertility.
excuse me, infertility gist for
This is life.
the longest, right? And with what we've shared so far, there's no excuse. There is no excuse. So tonight we want to look at
Every journey begins with hope.
ovulation in PCOS.
Every heartbeat tells a story. This is fertility.
We will look at why it fails, how it comes about, right? And how it comes back. With everything we've talked about already, we're going to add this and end it here tonight. Right? So you don't want to miss anything I say tonight. But if you don't even know what we've discussed about in the previous, go to the YouTube channel and you will be glad you did. Right? So PCOS and ovulation. Ovulation in PCOS. Why it fails and how it comes back. Right? A lot of people are struggling with this notorious thing called PCOS. The reason they are struggling is because of the way it has been painted and lack of information. But tonight we'll give you information. Excuse me. I know you've heard about this before. PCOS affects ovulation. Yes, it does. It does. But the statement is too shallow. If you make that statement and stop there, it's too shallow to help the person that is listening to you. But trust that will tell you the what, how, and why of anything we talk about. Just be patient. Be patient enough to follow all the live stream. Right? Be patient enough to follow all the live stream and you'll be glad you did. Right? So I was saying that PCOS affects ovulation is too shallow. So I was saying that if I just told you that PCOS affects ovulation, that statement is true, but it's too shallow to help you. Because you are the one that is trying to conceive. They have been sentenced to PCOS, and you now think that PCOS means that you will no longer be pregnant. It's not true. That's why we're giving you details, right? So before you start crying out of ignorance. So that statement is too shallow. It doesn't tell you why ovulation fails in the first place. It doesn't tell you what exactly breaks down and if ovulation fails. And it definitely does not tell you how to restore. Right? And that is the most important part of the gist. How do we restore this matter? So let's do a proper justice to this matter tonight. Right? Let's do a proper justice. So what we're going to do tonight is, I know some of you want to go to bed by 10. If we don't finish by then, I will still continue. So just close the live stream, go and sleep. Go to YouTube tomorrow, it will be there. Right? Because I must finish PCOS today. Right? So what we're going to do tonight is we'll open the system. We'll trace the signal, all the signals that is responsible for this fertility thing.
This is fertility.
I will follow where the breakdown that leads to PCOS came up. Because if you know,
This is life.
it will be easy to look for solution, right? Whether you're looking for natural solution or you're looking for orthodox solution, right? It will be that easy. Because when you understand ovulation in PCOS and you even understand it at the mechanism level, something will shift. And that's what we're all about. We want that shift that will happen. So you stop guessing and start making precise decisions, right? Who is ready for tonight's gist? Let's go to the first thing we need to talk about as we try to understand ovulation in PCOS. Who is ready for this gist tonight? Please tap on your screen, share the live, give people opportunity to learn something. Right? If you're just joining, you're seeing me for the first time, you want to follow me.
This is fertility.
Right?
This is life.
So let me throw out a flare. If they will allow us to use it. They don't allow us to use it. Alright, so the first thing we want to talk about. Let's start from the beginning.
Every journey begins with hope.
This ovulation that we say that PCOS affects. What ovulation is? What is it supposed to look like? Right? So in the simplest possible language, we'll remove all the medical jargons and give you in simplest possible language. Good evening, Mommy B. I see you. I'm all right. I'm fine, thank you. Before we begin talking about failure, right? I need to give you a clean picture of what normal ovulation is first, so that we can now know where failure is, right? Mommy B, I will answer that question. If I don't, I think I have an episode that will deal with that. So you want to exercise patience. Enjoy this one. PCOS first, right? Mrs. Mike, I see you. Good evening. Thank you. Thank you too. You're welcome. Thank you for joining. So the first thing I want to do is to clarify what normal ovulation is supposed to look like. Simplest possible language. Leave all the jargons, medical jargons, right? So in a typical cycle, right? What you call a typical cycle. This is what happens. This is what happens. You don't even need to go to school to know this one. What happens is that the brain sends signals. Everything that has to do with reproduction starts from here, from the head. Including knacking, it starts from here. Right? So I always advise people, get into people's head instead of getting into their, right? Because if I get into your head, you will follow me anywhere I go. Anyway, let's come back to the gist. So in a typical cycle, this is what happens. The brain will release signals, right? And those signals, thank you very much for the heart, right? Those signals are what you call FSH and LH. I'm sure you've heard that before. These are hormones, and that hormones are released in the brain. So the brain releases signals. These signals, their job is to go to the ovaries. I'm talking about women, so I'm talking about ovaries, right? They go to the ovaries and influence the ovaries. The ovaries respond to these signals that is coming from the brain by growing multiple follicles. Then what is follicle? Follicles are just tiny structures. They are fluid filled, and they contain eggs. Just like you have groundnut, right? The real groundnut is inside the pod. So the same thing with the eggs. The egg is not just open out there. No, they are contained in what you call follicles. So if you hear follicles, that's what they're talking about, right? So these follicles begin to grow because of the signal of FSH and LH that is coming from the brain. So they begin to grow, multiple of them. Now, as they begin to grow, one of them becomes bigger than others. I will call that the dominant follicle. That is a normal thing, right? Now, it is that one that is bigger than others that will eventually rupture and ovulate the egg. Ovulation means the rupture of follicle and the release of the egg into the fallopian tube. Full stop. That's what ovulation is. It's not a big thing. So when you hear ovulation, it means that egg has been released. Full stop. Right? So that bigger one will rupture and ovulate, releasing the egg. Now, the things that remain after the egg has left will gather themselves. And when they gather themselves together, it becomes what we call corpus luteum. Don't worry about the name, just understand something remains, right? It's called corpus luteum. It is that corpus luteum that produces progesterone hormone that sustains the next phase of your cycle. Is anybody understanding anything I just said? Do you understand? Up until this point, do you understand everything I just said? Talk to me in the comment section. Just type yes or no. Right? This is the simplest way to explain the female cycle. Right? As simple as that. So that is what normal is supposed to be. Everything is coordinated, everything is timed, and everything is controlled. It's not haphazard. Right? Now, I haven't known the normal in this simplest time. English, they had me. God will help. Right? So, I haven't understand this normal ovulation in the simplest term. Now let's see where PCOS disrupts this. Who is ready? Tonight now I'm a ball lecture with you. I know they for that's why my face is serious when I talk. Right? So who's ready to know where PCOS can bring in while I can join this normal thing? Talk to me in the comment section if you are ready, and as usual we'll take it step by step so that even the person that has always been in the farm, he has never gone to school, will understand it. Nothing is difficult. It's just that you don't understand the principle. You don't need to go to school to know it, right? So if you are ready, let's jump right into it, and I'll take it step by step. Step by step. Talk to me. Is it my network or something is going on that I don't know? I guess it's network. Excuse me. Is it my network? Okay, let me see if I can change network. This is fertility. This is life. Okay. I believe it's better. The network is just busy. My network is okay. Oh, really? Because I was not seeing activities. I said, what will happen now? Maybe my village people, they don't start. Oh, boy. So let's start with the first thing. Every heartbeat tells a story. Right?
This is fertility.
So let's start with the first step. Step 1. And we're going to start from where it all begins, the brain. Remember that there has to be the proper signal that comes from the brain to the ovaries. Now, if at any point or for any reason that message, that communication between the brain and the ovaries is distorted, that is where the problem of PCOS starts. In PCOS, the process doesn't start clean. There's already a communication problem, right? Communication problem has already started, right? It's either the brain is releasing too much FSH or too little FSH, or it's not even releasing the thing on time. Follow me, slow down. You understand this thing? You understand this thing? Right? So the brain sends signals, but not in the right balance. That is the beginning of the problem. You can have LH higher than what is supposed to be. Then FSH lower or even insufficient. For some reason, the timing is even off. Confusion. This imbalance matters a great deal. If there is an imbalance between LH and FSH, it matters a great deal. The reason is because you see FSH, that is what pushes the follicle to mature properly. So the very thing that is supposed to make the follicles, or what you call egg, the very thing that is supposed to make the follicle or egg mature properly is now either coming late or not sufficient or is poor. You already know what that means. Without enough FSH, the follicle will start, right? It will start growing, but they will not gain momentum. Why? Because nothing is pushing them to grow further. So you can see that from the beginning, the system is already unstable. So, long story short, a miscommunication between the brain and the ovaries is the beginning of the PCOS gist. Comprehend up until this point? If you understand, talk to me. Just type understand. Then we'll move on to step 2. Right? Step 2 of the problem. This notorious PCOS. Right? Step 2 of the problem, I've mentioned a portion of it. Hi, Tracy. Good to see you. Right? I've mentioned a portion of it. The follicle begins to grow, but none of them becomes dominant. Remember, in the normal, when we're talking about the normal, one is supposed to become dominant, bigger than others. But in this case, multiple of them start growing, but no one become chairman, right? Have you ever been in a society, a community where there is no chief, no chairman? So that is PCOS. A lot of follicles without chairman. That is PCOS. Are we understanding anything? If you stop understanding, just tell me I don't understand again. We'll just close the live stream and go away. Right? Because there's no need talking when you don't understand.
Every journey begins with hope.
Are we understanding anything? Oh, you don't understand? I want to be sure people, you are just coming, so you cannot say, you know. You are just coming. There were people here. So just stick around, you understand, don't worry. You understand? So that is step 1. Step 2 of the PCOS problem. Right? Step 2 of the PCOS problem. Follicle begin, but there's no chairman. Despite the imbalance of the signals that is coming from the brain, the ovaries will respond, right? The ovaries will respond regardless of the imbalance of the FSH, LH hormone. The ovaries will respond. And that's why you have multiple follicles that begin to develop, right? But here's the critical fallout in the gist. No single follicle becomes dominant, right? Why? Because the growth is stalled midway due to the imbalance of FSH, LH. So the selection process of who become the dominant follicle fails. So none of them is dominant. So instead of you to have one strong follicle that leads the group, what you have is a crowd of small underdeveloped follicles that are competing, and none of them is winning. This is the classic PCOS appearance on ultrasound. So when you go for ultrasound and they tell you, oh, madam, you have PCOS, that is what they saw. They saw multiple follicles, but none of them is the chairman, right? So, but again, understand that this is not a disease. It does not mean that your ovary is diseased, no. It does not mean that your ovaries are broken. No, they are not broken. It's not damaged. What you're seeing is just an uncompleted development. Excuse me. Uncompleted development. Hello, Anina. Good evening from Zambia. Good to see you. That is step 2. Step 2, I just showed you. That's what they saw, or that's what they will see on ultrasound. So, madam, I think you have PCOS. But remember, PCOS is a syndrome. It's not just one thing that causes it. It's not just one thing that causes it. It's multiple things, right? And that's the multiple things I'm telling you. Then we'll now have the good news at the end. Is that okay? Step 3 is where androgen quietly sabotage the process of ovulation. This is where we'll go deeper, right? In PCOS, androgen means male type of hormones, right? Because, excuse me, what make women are female hormones. What make men are male hormones. And male hormones are called androgens, right? Now, in PCOS, these androgen levels are often, that is the male hormone levels are often elevated. And by the way, that you are a woman does not mean that you don't have some levels of male hormones in you. You do, because it has its relevance. The same way for men have some female hormones in them. It's relevant, right? But they are not supposed to pass a certain level. But in PCOS, these androgen levels are elevated beyond what they are supposed to be, right? And they interfere with follicle maturation. They interfere with maturation of follicles. They will reduce the sensitivity to FSH. Remember, FSH is what is responsible for maturation of follicles. So these elevated levels of androgen now will interfere with the sensitivity and reduce it to FSH sensitivity, right? Good evening, MSEG is here, right? And therefore disrupt the internal environment of the ovaries. That's what it does. Thank you very much for the heart, me, and go popular. So even if follicle try to grow, they are growing in a hostile hormonal environment. I understand what I'm saying. Calm down with your questions. I need you to understand this thing. I know everybody have questions. You want to say something? Calm down.
This is fertility.
Because if you don't understand where your problem is, you will be confused for a very long time. Right? So calm down. Let me give you clarity. Excuse me. So where was I? I was saying that. So even if follicles try to grow, they are growing in a hostile hormonal environment. And what would that result to? It would result to slow development of follicles or even arrested maturation. They started, but they cannot mature. And eventually, no ovulation. Are you beginning to see why it's difficult to ovulate when you have PCOS? Are you seeing what I'm saying? Cure your confusion today, then we can give you some solution. Is that okay? This year, everybody go born. I'm telling you. So long as you didn't knock what's no good though. So you want to say, oh, I want to born, you're not knocking. You shift from here. Where was I? Where was I? So that is step 3. Step 4. Right? Step 4. Please tap on your screen. Take the likes up. Share the live. Let people who are trying to conceive find us. I'm more interested in those that are trying to conceive, so that we would reduce tears. Right? People are crying for nothing. Ignorance. And their love is here. Right? So let's talk about step 4 in this PCOS issue. Excuse me. Step 4 is, this is where we introduce insulin. Insulin amplifies the breakdown of everything we've been saying. Insulin will just come and exaggerate it, amplify it. Right? And this is the hidden engine in many PCOS cases. Insulin problem, insulin resistance, the chief of the problem. When the body becomes less responsive to insulin. Every journey begins with hope. Right? Insulin is supposed to be produced to help your body use up sugar. But because of the nonsense sugar you people are eating, sugar wants to ask questions. Sugar, I'm talking about you. See what you are causing. Sugar said you want to say something. I will not let you say something now. You wait. Let me talk about you finish. Is that okay? Every heartbeat tells a story. So what I was saying was that this is fertility. When you eat something and sugar gets into your system, the body produces insulin to take it out to be utilized, right? And that is a normal thing. Insulin is not a bad thing, right? But because of the nonsense things people eat these days, processed food and all that, so both Well, the insulin level gets to a level where it's too much. And I've explained all that, so I don't want to go deep so that we don't get distracted. So insulin level gets to a certain level, and the body is like, why is this guy always around me? I don't want you anymore. So the body is resisting the insulin, right? Insulin resistance. Now, when the body becomes less responsive to insulin levels continue to rise. And now that excess insulin stimulates more androgen production. Remember androgen, the male hormone we talked about earlier? It was already doing its shenanigans. Now insulin has become a problem. So it's now causing more of that androgen to be produced. Right? Excuse me. So what do you have? Now the system is reinforced in the wrong direction. More insulin means more androgen. More androgen worsens follicular development. And as follicle development worsens, no ovulation. No ovulation, period is confused. It's a positive feedback mechanism. Positive feedback mechanism. Thank you very much. I'm sure it's simple enough for you to understand. It's not rocket science. It's just to understand what is wrong with you. Right? And this is not a one-time issue because it's a positive feedback mechanism. This one has happened, that one is affecting this one is causing this to happen, and the cycle continues over and over and over again. It's a loop that sustains ovulation failure. Remember all the things I've mentioned. Go and write it down. What are they?
Every journey begins with hope.
So that is step 4. Step 4 is the positive feedback mechanism where you have where you have more insulin will cause more androgen levels. More androgen will worsen follicular development. In other words, follicles cannot mature. Worse development of follicles means no ovulation. No ovulation means irregular cycle. And the system just continues in cycles. In cycles. It's a loop. A loop of ovulation failure. Right? So that is step 4. Are you understanding anything? If you're understanding something, talk to me in the comment section. Just type understand and tap on your screen. Think about those people who are suffering PCOS issues. If they could just find this information, it would change their story, right? Oh boy, I'm thinking about you. I'm thinking about you. By the end of this year, we'll know the difference between you go born. That's the long story short. Step 5. Step 5. Thank you very much. Olu Mary K. Thank you. Step 5. Step 5. Now we have arrived proper at where there is no ovulation. And if ovulation does not take place, for those of you that came late, I feel very sorry for you because you did not hear the normal cycle. I wish you heard that, but just stay with me, you understand. All right? So if ovulation does not take place, it means no progesterone. Why? Because when ovulation takes place, whatever is remaining after the egg has come out of the follicles, they gather themselves to become corpus luteum, and corpus luteum is responsible for producing progesterone. In this case, ovulation will not take place in your cycle. So where will the progesterone come from? Right? This part is often overlooked, but it explains a lot in the whole confusion. When ovulation does not occur, progesterone is not produced properly. Full stop. Is there any confusion up until this point? Do you understand anything I'm saying? Who is confused? Right? When ovulation does not occur, progesterone is not produced properly. And what does that mean? Without progesterone, do you know the implication of that? It means the cycle loses structure. You see, your cycle is bending like this. Another day it bends like this. Another day it bends. You see, I know you understand this cycle. That's why people with PCOS have irregular cycle. Are you following the gist? If PCOS is a challenge for you, you got to stay till the end. Is that okay? Stay to the end. Stay to the end so that you learn something that will change everything. And by the way, let me quickly remind us that our preconception blueprints, the ebook is out. If you're trying to conceive, this book is for you. Go and download it now. The link is in my bio. It will change how you walk your journey of fertility. Go there now. The first 50 people, 50% discount, right? Go there, collect it. So wife, friend, sister, colleagues that are suffering infertility. You'll be amazed what that will do to you and for you, right? So the preconception blueprint is out and available. By May it will be launched, so go and grab it now that you can find it in its discount. All right, let's continue our gist. So I was saying, what's happening to the network?
Every journey begins with hope.
What's going on here?
Every heartbeat tells a story. This is
Now I said progesterone when ovulation does not occur.
This is life.
When ovulation does not occur, progesterone is not produced properly. And without progesterone, the cycle loses structure. You just have irregular cycle, just all over the place.
Every journey begins with
right?
hope.
The lining of your uterus
Every heartbeat tells a story.
is not built.
This is fertility.
Of course, the same confusion happens to it. It's also irregular, right?
This is life.
And menstrual bleeding becomes unpredictable. It's unpredictable. You don't even know yourself. That's the problem with PCOS, right? So when the cycles are delayed, skipped, irregular, it's not random. It is a direct result of missing ovulation. And you already know how that happens. If you understood up to this point, talk to me in the comment section. Just type understand. If you do not understand, don't say anything because you are just coming. All right? But don't miss If you miss anything, just go to my YouTube channel, Dr. Gordon EMB. Go and catch the gist there. The details there for you. Right? So let's go to the next step. Step 6. Right? In step 6, we want to tell you, yes, we will have question and answer, certainly. So if you're just joining for the first time, you don't know we have question. We do have question and answer. So calm down. Calm down, huh? Learn something first. More likely I would have answered your question before we get there. So just relax, we will. Is that okay? So let's get to the point. I think we are here now, step 6. Why ovulation sometimes happen in PCOS and sometimes it doesn't happen. Right? Confusion, right? So we said all this confusion is happening and ovulation will not happen because this one happened, that one, everything I've said. So why would ovulation happen sometimes and sometimes does not happen in PCOS? Who is ready to hear that amebo this night? I'm not teaching, no. I'm just giving amebo. This is clinical amebo I'm giving you. There's nothing to teach. Are we in school? Right? We're not in school. Now amebo will do. Please tap on your screen, share the live. Right? Let's continue our clinical amebo.
Every journey begins with hope.
Right? The gist is helping. Of course it is. It should. Thank you. Thank you. Why ovulation sometimes happen? Sometimes it does not happen. Now, PCOS. Sorry, I'm still recovering from Friday, Saturday issues. So,
every heartbeat tells a story.
And of all my wonderful people, it's only one person that check on me. God, I beg. I'm going to disown everybody in this live stream. I'm going to disown everybody.
Every journey begins with hope. Every heart
All right.
tells a story.
Step 6. Why ovulation sometimes happen and sometimes doesn't. You see, PCOS is not always a complete shutdown, right? Given everything we've said, it's not a complete shutdown. Some cycles, right? The system will break down.
Every journey begins with hope.
Right? Even though the system has broken down in some cycle,
this is fertility.
In some other cycle, one follicle will manage to get to maturity and ovulation will occur. Right? Whereas other cycles are stalled. Now, this is the reason why some people with PCOS ovulate occasionally and have irregular but not absent cycle. They have cycles, but it's not regular, right? But it's not absent, right? They say, are you seeing your cycle? Yes, but it's not regular. We know because of the things we said, right? So in this case of PCOS, fertility becomes unpredictable Listen, I said unpredictable, not impossible. So if you are there crying, oh, I cannot be pregnant because they said I have PCOS, I don't know what you are crying for. It is unpredictable. It is not impossible. Have you not heard of somebody with PCOS that conceived naturally? How did they do it? Stay on the live stream. We will continue. So at least you got one good news today. The good news is that in PCOS, fertility becomes unpredictable but not impossible. So let's hold on to the possibility. Oh boy. Let's go to step 7.
Every heartbeat tells a story.
Step 7.
This
right?
is fertility.
And step 7 is where good news begin to emerge. Right? I see so many people, you spend hundreds of thousands because of this matter. And I'm just telling you as if, you know that kind of gist where two people in the kitchen, as they cook, they gist. That's what we are doing with this PCOS today. After tonight, PCOS don't get levels. You don't get levels. So step 7. Step 7 is the turning point. Right? Is the turning point. How ovulation is restored. We've seen the breakdown. How it was broken down. Right? First we start with what is normal. Now we look at how it was broken down. The solution now becomes clearer. Why? Because you don't force ovulation blindly. Which of course, oh doctor, I'm trying to conceive, and I have PCOS. What did they do? Bomb you with drugs. Bomb the hell out of you.
Every journey begins with hope.
Right? But you don't force it blindly with this kind of information.
This is fertility.
What you do is you correct the environment that allows ovulation to happen. That's what you do. And I know somebody say, oh, talk to me. How do I correct it?
Every journey begins with hope.
You correct the environment.
Every heartbeat tells
And I want to tell you how to correct this environment. I'll just give you 3 points to work with.
This is life.
Number 1, improve insulin sensitivity. Improve insulin sensitivity. When insulin levels stabilize, androgen production. Remember, androgen was doing his shenanigans before insulin came and exaggerate. It can't scatter the table, right? Right? So, androgen production will reduce. The ovarian environment will now improve because the insulin that is influencing the androgen has now been taken care of. Androgen will go down to its normal levels. Then the ovaries head will correct. Right? That is the first thing. Okay. And it's very simple. Do you know that the same way you got yourself to insulin resistance is the same way you can reverse it. How? Many of nowadays, how we eat is just junk nonsense. I will eat too much. Who told you you're supposed to eat 3 times a day? Even in your religious books, there's nothing like 3 times a day eating. Right? That's one. Number 2, you also eat. Your activities does not show how you are going to burn down that energy. You eat fufu in the night before you sleep. Wake up in the morning, do akamu and akara. In the afternoon, chop rice. In the evening, eat pounded yam. Your what do you call it, glucose level is always up there. And as it's up there, insulin level is also pursuing it. All right, so what happens? Train your body now. That come, we know they get the abundance where you know before. So it's morning and evening. If you don't see afternoon, go and rest. you are indicted. Right? You understand? The same way you got it up there is the same way you should bring it down. So what do? Train your body again. That we're not going to be seeing more than enough glucose again. Your body now begin to learn. The good thing about the human body, it adapts. It adapts. Right? So you want to improve insulin sensitivity. So say, give me one drug. You see, drug, take. Always looking for something to take. Simple ideas I'm giving you like this. I don't vex. You will go start with the pain now. Right? That is the first thing. Rebalance hormonal signals. Remember, the hormonal signals coming from the brain is already having issues. Right? How do you rebalance it? By supporting proper FSH activities. And if FSH activity is supported, it will help one follicle to gain dominance. Right? Most times, you are just giving yourself. When we tell people sleep, when we tell people manage your stress, they think we just give me drug to solve that problem. You cannot use drug to solve that problem. You know what you are doing? When you try to use drug to force your body, you will get the result. But is it a quality result? And can you repeat that result? I will leave it there. Number 3, reduce androgen levels. Because when androgen drops, follicle will respond in a better way. And follicle matures. Excuse me. Follicle matures. Right? Follicle mature. Right? Number 4, you want to support ovulatory triggers. In some cases, I did not say in all cases, in some cases, you need medical support, you need medical help where they induce ovulation. Right? And help you regulate timing. Yes, androgen. That's the correct spelling. Right? They'll help you. But these other things I said, would you not do it? Some of them are even in your hands. I don't vex. I know talk against us.
Every journey begins with hope. Every heartbeat tells a story.
So what changes when ovulation returns? Wow. Ovulation has come back. Oh boy. You see, when ovulation returns, even if it's partially, you know what happens? Your cycle becomes more predictable, right? Progesterone will rise appropriately. The uterine lining, right, will stabilize. And the chances of pregnancy will improve. All the solution you need for this PCOS problem, I just mentioned them. If you do not understand, go to my YouTube channel and listen to them again. I don't know how else you want to hear it, but this is the solution. Right? All these things I just mentioned just now.
Every heartbeat tells a story.
Gives you an idea why ovulation is the central focus. Of course, it has to be central focus because if there's no egg, no pregnancy. But in this confusion of PCOS, once ovulation returns, the entire system begins to normalize. So what did I say you should do? Take care of the insulin resistance issue. Deal with androgen, reduce androgen influence. Right? Sometimes you may need to ovulation triggers. Right? So I've just helped you. Go and do the rest. So to simplify the issues like we've done, right?
Every journey begins with hope.
Do something, just one small powerful truth. Everything we've said tonight. PCOS does not destroy ovulation. It doesn't. It only disrupts signals, the timing and hormonal balance, right? But the system is still there. And the system can be corrected. That's what I just said. If you listen to the video again, you will find out that the problem and the solution is in this one live stream. And there was no place I gave you something that will cost you more than enough. I'm just thinking of some people market don't go move again. So just watch the video. Go to YouTube and watch the video, right? I just spoil market for some people. So I'm just thinking. That's why I'm talking small. That problem can be corrected. Apart from in some cases that you need to trigger ovulation. You did not hear where I mentioned any medication because I just help you solve one of the biggest problems that people are crying about. Okay, more no ladder. If you know here, go and rest, right? Anyway, if you have PCOS, right, and you're worried about ovulation, don't just ask, am I ovulating? You want to ask something deeper, right? You want to ask something deeper. What is blocking ovulation in my case? Remember the first part of this PCOS gist last week? Go back to that video. You understand? You want to ask, what is blocking ovulation in my case? Your colleague in the office, her PCOS case is not your case.
Every journey begins with hope.
So you don't expect to do what she did to get results, right? So you want to ask the question, is it insulin that is my problem? Is it hormonal that is my problem? Is it both? Right? Which part of the system needs to be supported? And that's why this video, when it goes live on YouTube, follow it, watch it over and over and over again. The only thing you need is data. But if you don't watch it, don't worry, you go pay money. You go cry in Gege's voice. Because once you identify the real barrier, the path forward becomes clearer. I'm just thinking about you. What you've been battling it for years. Just simplify it like this. This is so simple. And some of you need to cut down your weight. Anyway, tomorrow I'll come for all of you that have all these my LVDs, right? I'm coming for you tomorrow. Either you join the live stream or you run away. I will follow you anywhere you go. Right? So before I start taking questions, ovulation in PCOS is not a mystery. Ooh, I have PCOS. Ooh, I cannot ovulate. You didn't hear me. It's a process that was interrupted. Good evening, Ogetami. It's a process that was interrupted. It was not erased. Ovulation was not erased. It was only interrupted. And when you understand where the interruption happens, you gain something powerful. You know that thing? What you gain is the ability to restore it. And I've said it tonight, how to restore it. So, your hundreds of thousands that you've wasted was for nothing. It was lack of knowledge. All right.